We continue now with our coverage of the healthcare systems around the world, and tonight the quality of healthcare in Chile and how it compares to the healthcare system in this country. Healthcare in Chile is focused on illnesses that have the most impact on the country. Its system is seen as a success. Life expectancy in Chile is 78 years. The prosperous Latin American country of Chile offers both public and private insurance systems to its near 17 million citizens. 75% of Chileans participate in the public plan, 25% choose a private insurer.
This competition has led to improvements in the public services and the public insurance, and it has also reduced some of the kinds of problems that people have had with private insurance. It's made the private insurance companies more open to not excluding people that had prior conditions, and has encouraged them to make better offerings.
Those employed in Chile, a fairly large part of the population, pay 7% of their income for insurance, either the public or a private plan. A general tax revenue pays for the coverage for the unemployed and the Chilean poor, but they must enroll in the public system. Chile spends 5.3% of its GDP on health care, compared with 16% in the United States. In the past 5 years, Chile has taken extraordinary measures to change the way it focuses resources for health care. There are currently 56 health conditions and diseases ranked as having the highest burden on the country. They include end-stage renal failure, HIV/AIDS, heart conditions, and many forms of cancer. Those conditions are completely covered by insurance and treated by a set of protocols established by Chile's Ministry of Health.
The protocol established the basic things for diagnosis and for the fastest or earliest treatment possible. And that's a guarantee. And then you get the treatment that is the best available for the Chilean standards. Of course, it's not the best standard in the world, but it's an average treatment that provides effectiveness and cost effectiveness.
This protocol system has helped provide more equality in treatment in both private and public medical care.
The general surveys of patient satisfaction and of public satisfaction with the program have been quite good. So people feel that they're working. And we had worried that the doctors would be unhappy with the protocols. Doctors tend to want to practice as they had been taught. And so we were afraid that they would feel that their own independent judgment was being limited. And that's not happened.
Life expectancy in Chile matches that of the United States at 78 years. Now, there was concern that concentrating on the list of 56 health conditions might lead to a lack of attention to many other types of illnesses, but that has not been the case. What has happened in Chile is that the investments and improvements in diagnostics and facilities to treat these 56 diseases has spilled over into other types of medicine. Meanwhile, the Chilean government is in the process of expanding the list of covered conditions.